So medical aid is often one of the first expenses that people consider cutting during financial hardship, but cancelling it can expose individuals and, of course, their families to substantial financial and health risks. South Africans are reported to be opting out of those expensive medical aid schemes, and according to data from Stats SA, fewer South African households have medical aid today than 10 years ago. So experts say this consumer action is making the model unsustainable. Another disturbing factor is that 15% of South Africa's healthcare spending is lost to fraud, waste and abuse. So the Board of Healthcare Funders announced that this costs the sector about 30 billion a year. According to that organisation, common abuses including procurement irregularities, counterfeit medicines, price fixing, duplicate claims, overservicing and fraudulent billing. Let's chat a bit about this. Such an important conversation to have. Dr Mzukwa, who is the chairperson of the South African Medical Association and recently elected president of the Confederation of African National Medical Association. Doctor, thank you so much for your time. We really, really do appreciate it on this Sunday. I mean, this is such a concern. Look, times are tough economically, and already, if we look at it from a South African context, communities are looking at where they're going to have to tighten the belt. The belt is already tight enough. So it seems from these statistics that I'm reading, South Africans are now dropping out of medical aids, and which is not a good thing in the long term.
Good morning to you and to your viewers, and thanks for this opportunity. Now, it is a significant concern that is raised by our colleagues. But the issue is that we need to understand that people are struggling. They are unemployed or they've gone out of employment, but also the rising cost of living. There's issues of rising premiums of medical aids. There's a lot that is South Africans are facing on the ground. And that then leads to other challenges where they may feel they need to drop the medical aids. We still have relatively stable numbers, but that is very shaky because people have downgraded their medical aids because they can't afford due to the reasons that I've outlined. I mean, the economy is growing slowly as well, adding to the burden that is out there to communities.
Yeah, and I mean, to what extent, does this drop in medical aid, medical scheme members affect the medical fraternity? And I think most importantly, what does this then mean, when you don't have medical aid? Obviously, communities are buckling under the rising cost of almost everything. What does this really mean for the medical fraternity, I guess?
It has dire, complications, if I may put it there. It's profound because if you look at it, it means that people will delay diagnosis. First of all, they will go to a state institution, but you remember that the public sector is already overburdened and overstretched in terms of human capital, but also the infrastructure, the consumables like your medicines. There's a lot that is happening out there on top of the austerity measures that government has implemented over a decade. So those are the challenges that they're facing. But the issue is people then delay diagnosis and then wait until the condition is complicated and is even expensive to treat. So those are the challenges that will be faced by communities on the ground. And that's a serious concern for us, all of us.
Yeah. And I mean, that then runs the risk of having consumers search for alternatives, possibly, to a medical aid, like self-medicating. There's a reality. And also using alternative medicine. I mean, is this model sustainable?
Well, at a long run, it is not sustainable. Alternative medicine is good, but to a certain extent. I think it is always important that we need to adhere to evidence-based treatments that are out there, because most of them, even though they are touted as proper and effective, but in reality, at times you find that that's not the case. It was done just to attract a consumer to make that payment. But on top of that, these alternatives at times they delay the diagnosis and the proper management. You find that again we're going back to a very expensive management of that person when that person is complicated. So those are the issues that we're faced with. There's drug to drug interactions. There's allergies that are out there that may be caused by these alternative medicines. But the other challenge is that we find people using out of pocket payments. That is not a sustainable model over a long period, because you remember there are other catastrophic events where you find that a person has been diagnosed with cancer, and cancer management is very expensive. There may be accidents, there may be heart attacks, all these things, they come, you are not prepared. But also there are chronic conditions, where you find that you might not even have symptoms, silent conditions like diabetes, hypertension, and many others. So when people drop out of medical aid, they can't be screened. They miss that opportunity of being screened and have that those conditions detected earlier, before they complicate.
And I mean, what about the growing number, doctor, of, working South Africans that are also choosing to self-fund their medical costs? I think I was listening on one of the platforms this week where people have actually decided, okay, when I'm sick, I'm just going to take out money from my pocket instead of paying for something on a monthly basis, not knowing when I'm going to get sick. When I get sick, I'm just going to take money from wherever I find it and just fund whatever illness I have at the time.
Well, at a long run, again, that is not sustainable. Remember, in medical aids, they assist, especially when you have those catastrophic events. Where you find that you are involved in a motor vehicle accident. You may even spend time in hospital. You may be out of work for a number of months. So you're not making money, but you're also spending time, and the medical bills are growing. So it's not a very sustainable model. That is why we see, even if you find it heavy on the current plan of medical aid, but perhaps it's good to change to a lower plan instead of just losing that. Because remember, if you say I'm going to be paying for myself, for smaller ailments like flu and any other thing, it's possible. But for bigger events, it becomes a challenge. And if you go to the state again, it is that problem that when people think about going to a state, they think about long queues and all these things, and they delay the management of their conditions.
I mean, another disturbing factor, let's move to this now, reports that 15% of South Africa's healthcare spending is lost to fraud, waste and abuse. That is quite staggering.
It is a huge concern for all of us, for the entire healthcare system, because it's a number of reasons why you have that. It's not only in the practicing practitioners; it is also other levels as well. And it makes issues difficult, because premiums, they tend to rise not because of healthcare costs, but because of these other problems like corruption. And this happens in the private sector. It also happens in the public sector. So it's a societal problem that we've got to deal with as South Africans, but also and working together as stakeholders in terms of the law enforcement agencies, the medical associations, government itself, and the funding industry as well.
Yeah, and I mean, reports also suggesting that 30 billion is stolen a year in the healthcare sector. Fraud is the serious concern there. And the culprits are also seemingly medical practitioners.
Yeah, it is true that there are some medical practitioners who may be committing fraud, but we must remember that majority of them, majority of South Africans, medical practitioners, are ethical people who are treating their patient professionally and ethically so. But like in any other sector, you do find a pocket of those. But if you look again, it's not only the medical practitioners. There's patients involved. There are at times administrators. There are issues there, where you find that there's misuse and abuse and even fraud when it comes to this, medical aids. But you find also, you remember, there's also cartels where you find that there are a group of criminals who are working together. Not even practitioners. They may be using practitioners' details, but those people are not practitioners. They are committing fraud using existing practitioners who are registered with HPCSA, but also registered with Board of Health Funders. Yeah. So there is stolen identity that becomes a problem in that regard. And I think we work together on this to identify this and not only just assign the blame, but making sure that we're working together to identify these individuals.
And certainly the role of SAMA in curbing and educating, members about this kind of corruption is something, obviously, that, it has been ongoing.
Well, SAMA is a professional medical association. We promote ethical conduct and professional conduct through our webinars, our workshops, these continuing professional development activities. So we do advocate for such conduct in collaboration with the ethical standards of the HPCSA. So HPCSA is our regulatory body, but we work together in terms of making sure that our members understand the gravity of practicing unethically. But like I said earlier on, majority of them, you find that they are professional and ethical, but you do find those small pockets, that are causing harm, to the funding industry, but also to the integrity of the medical profession.
Of course, thank you very much indeed, Doctor. And finally, congratulations on recently being elected the president of the Confederation of African National Medical Association. Thank you very much indeed for joining us, and congratulations to you, Dr. Mzukwa, who is SAMA's chairperson, speaking to us about medical aid and people or communities cancelling. One of the first things they're starting to cancel now is medical aid when they find themselves in difficult financial situations. This is something that has been raised by those as a concern by those in the medical sector. All right, Doctor, thank you very much indeed for your time.